Hello, we are very excited to share with you our project, and we're from Nottingham University NHS Trust. My name is Sim Kun, I'm the consultant with the inpatient unit, Haywood House Specialist Palliative Care Unit, and I'm joined by Nicola, who are also the nursing leads of our project. Today I'll share with you a background of our project, how we implement it within 150 days, what the outcome measure is, what we have achieved, and also share with you a bit about feedback that we receive. So the National End-of-Life Care Strategy put great emphasis on fulfilling patients' needs and the preference of care to enable good end-of-life care. They define good end-of-life care as coordinated, personalized, and and compassionate care. Regionally, we support that, and we have not regionally recognized that EPACCS, which I will tell you a little bit more about what is EPACCS, has been seen as a very useful tool and enable effective communication between within primary care and also between primary care and secondary care. And this is our trust strategy who also support that. So what exactly is EPACCS? So EPACCS is a electronic palliative care coordination system that enables the sharing and recording of patient preference of care. And this has shown to help increase the proportion of patients dying at home and also reduce unnecessary hospital admission and unnecessary intervention, overall improving coordination of care. And this is the EPACCS template that is available when we log into it. It's very simple, user-friendly, and it's correlated to the gold standard framework when we talk about prognosis of patient care plan. In Nottingham, we have been using EPACCS since September 2014, and as you can see, mainly started off being used by primary care team, recording information in EPACCS and sharing it within the team in the community, i.e. the community district nursing team, community palliative care team, of our GP, and also ambulance service. And this will enable important information like do not resuscitate, preferred place of care to be shared widely within the team. Haywood House has been able to access EPACCS since 2 years ago, so we're able to see when patients admitted to Haywood House what their preference of care is and what the do not resuscitation status is. However, since the implementation of our project, we're able to input data on EPACCS and let it share widely across the primary care. And a unique point of our project is the collaborative working. And part of our team, we have the quality improvement team by the Trust, who have shared with us widely of how to use various different methodology, including thinking about effective project management, sustainability score, and think about sustainability very early on of our project, making sure that always we are focusing on patient care as a priority. And this is our driver program. We started off quite brightly, thinking about the six ambitions and how we could improve things at the end of life. And this is our outcome. So we're hoping that at least 80% of a patient that are fast-track discharged from Haywood House would have their care plan input on EPACCS. So what do we mean by fast-track patient? Fast-track patient are patients who are rapidly deteriorating in their overall condition, are deemed to be entering the terminal phase of their life. And Haywood House is a 20-bedded specialist palliative care unit. Around 50% of our inpatients end up being discharged from our unit, and half of them are fast-track discharge. So we have encountered many challenges in the beginning of our project, and the main thing is engagement, clinical engagement, IT engagement, both from the Trust and also in the community. Thinking about funding very early on, how we can fund our project, because acquiring a license to use EPACCS do cost money, costs about £100 per year per user. So we need to make sure how we can sustain our project, ensuring that we got continuous funding. And also one of the challenges is implementing it within 150 days. So very early on of our project, we used PDSA cycle. I won't talk through every one of them, but just to show that we managed to engage the right group of people, get the funding, engagement of right IT people, both in the trust and also primary care team, enable the project to move forward. One of the challenges I mentioned very early on is about the disjointment of the various different system in our trust. So our trusts are not adopting to EPACCS, so all the information that key into EPACCS may not necessarily to be accessible by the other medical wards within the trust, except for Haywood House. So we address that problem by producing a e-discharge guidance to ensure that the junior doctors when they write the e-discharge letter, produce a good quality of discharge letter encompassing all these various different important points that is at the end of life, and all this information will be also inputted on EPACCS. This is a sample of a letter that was before our implementation of our project, and this is the quality of the letter that was produced after implementation of our project. As you can see, that encompass various different important decisions at the end of life for our patient. And this is the audit that we monitor on a month-by-month basis, looking at the percentage of patients that was discharged, fast-track discharge, and have EPACCS, end-of-life care plan entered into EPACCS. So we started off really well the first month, and as you can imagine, it dipped drastically on, as you can see from the chart here. Why is that? There's various different issues really. First of all is ongoing clinical engagement. Mainly the junior doctors are doing the discharge letter and also inputting information on EPACCS. Lock-in is one of the issues. One of the months there in December is where the changeover dates happen. So when our junior doctors change over, we weren't able to get the lock-in process, their lock-in and also the training process quick enough for them. So since then, we review our project, and with the PTASA cycle, we have looked through various different points to improve them, including embedded this practice into their daily discharge process, and then also regular reminder of the discharge process. So this is the feedback that we receive. Overall, you can see it's pretty good. We receive positive feedback from the primary care team in that they found information inputted on EPACCS were really useful, reduce unnecessary discussion, distressing discussion. The junior doctors, this is a YouTube website you can press and also view the video of his feedback. And overall, Haywood House, I find it really helpful. And this is feedback from our patient partnership group of our project, and I'll try to play it, and hopefully it will just be 1 minute. So, right.
That's not coming through the speakers.
The importance of involving patients and carers, and the patient
Sorry, I can't hear. It won't work, I'm afraid.
It's okay.
In the future.
Sorry about that.
We'll make all the clips available on the website so people can download it from there.
Yeah, so it mainly just to say that we have patient partnership group involvement very early on, so we ensure that our whole project is very much patient focused. And her feedback, Tricia's feedback on our project is that she's very proud to be part of it, and to see, and exciting to see the various different improvement that is in terms of her patient care. And I would like to share with you Terrence's story. So Terrence is a chap, 72-year-old man with metastatic pancreatic cancer. He lives in Nottingham, but also, unfortunately, his primary care providers are out of areas in Derbyshire. But with inputting information onto EPACCS, it can be visible, as you can demonstrate here, in other areas that might not adopt EPACCS, as the information will appear on System 1 as a summary reports. I was hoping to, move our project forward, involve other medical trusts, medical ward in the trust, and demonstrate the good practice, really.
Fantastic, thank you.